Yes, good evening. Good evening. Just a second. Hello. Yes, good evening, and I hope everyone, all you are doing well. And so we'll be doing a very quick session. Yes, we will be doing 20 MCQs, and we'll see that how we should think, how we should approach MCQ in the real exam, how to eliminate the options, how uh, when we are going to guess the answer, how we are going to guess the answer. So we are going to work on that. So starting with the paper, and we'll be doing this RDX quiz of having 20 MCQ. Am I audible, visible? All fine. Am I audible to everyone? Yes. Okay. So starting and mm, fine. So the first question is: a patient with severe fasting hypoglycemia is found to have glycogen with abnormally shorter outer chains. Which enzyme is deficient? Means this question is related to somewhat what the glycogen storage disease, and they are saying that there is glycogen is there with short outer chain. Now, if the outer chain is there, means it is somewhat related to the branching enzyme, maybe the debranching, maybe the branching enzyme. But what the question is saying is there is abnormally short outer branch is there. Means outer branch is there, means it is not getting removed. It is not getting removed means the debranching enzyme may not be there in this child. Debranching enzyme, do you remember the mnemonic ABCD we have discussed? So debranching, it is because of Cori disease, and in Cori disease, yes, we have the hypoglycemia also. So hypoglycemia with abnormally short outer chain, it is going to be Cori disease, and Cori disease, it is due to deficiency of debranching enzyme. The debranching enzyme is not there. Let's submit. Let's come to the next question. uh, Patient presents with the fasting intolerance and elevated levels of lactic acid. Fasting intolerance means there is fasting hypoglycemia. Lactic acid is more a deficiency in which enzyme is most likely? Pyruvate kinase, pyruvate dehydrogenase, pyruvate carboxylase, phosphofructokinase. Now I will eliminate this option very easily. Phosphofructokinase cannot be the answer because phosphofructokinase is a glycolytic enzyme, and this patient is having more lactic acid, means there is more anaerobic glycolysis is happening. So glycolysis is happening. This cannot be the answer. They're asking which deficiency is there. This enzyme deficiency must not be there. Now we know that glucose converts into pyruvate. From pyruvate, there is either lactic acid or there is acetyl CoA. Why this patient is not making acetyl CoA? Why lactic acid? Because maybe this patient is not having the enzyme, the pyruvate dehydrogenase, so is not able to convert the pyruvate into acetyl CoA and converting everything into lactic acid. Next is a patient with maple syrup urine disease. Maple syrup is branch chain amino acid. Which amino acids are found excess in the urine? Branch chain. The mnemonic is live. To have the branch relationship, the person has to be live. So maple syrup urine disease, live, leucine, isoleucine, and valine. Leucine, isoleucine, and valine. Right. The next is a patient is diagnosed with Lesch-Nyhan syndrome. Very simple, straightforward question. The moment I see Lesch-Nyhan, I will jump to HTPRTS, right? But still, we'll read the question. The deficiency of which enzyme is responsible for this condition? Yes, it is going to be HTPRTS deficiency. There is no doubt in that. It is going to be 100% short answer. Lesch-Nyhan syndrome, it's X-linked. It's going to be HTPRTS. The next is a patient presented with peripheral neuropathy, angiokeratoma, hypohidrosis. Which enzyme deficiency is responsible? Hypohidrosis means decrease in the sweating, neuropathy, angiokeratoma. The moment I will see this word angiokeratoma, the moment I will see this word angiokeratoma, it is going to be Fabry disease. And Fabry, do you remember Fabry? It is alpha or beta. We have remembered like this: alpha, fa. It is Fabry. Alpha galactocerebrosidase deficiency. It is Fabry. alpha galactoserbocides. Now, the when it comes to the next question, that is the newborn presents with the metabolic acidosis, hyperammonia, increased in the orotic acid in the urine, increase in the orotic acid in the urine. So, increased orotic acid and hyperammonia. Hyperammonia means there is some urea cycle disorder. Which enzyme deficiency is most likely? Hyperammonia with orotic acid urea, it is going to be hyperammonia type 2. Hyperammonia type 2, it is due to deficiency of ornithine transcarbamylase, OTC. It's due to deficiency of OTC, right? Very good. The next is a patient with hyperlipidemia treated with statins. Which enzyme is specifically inhibited by this class of drugs? Statins inhibits the HMG-CoA reductase. It's a very simple, easy question. Patients are treated, but because it's an easy question, I don't want to make a mistake, so I'll just reread it again. Statins, and they are asking which class of drug? Sequalin, acetyl-CoA, fatty acid. No, it is HMG-CoA reductase inhibitor. Right, this is an easy question. A patient presented with the progressive hepatosplenomegaly, anemia, and the bone crisis is there. A bone marrow reveals lipid-laden macrophage resembling crumbled tissue paper appearance. Actually, when I reached till this point, there were so many things were going in my mind. But the moment I saw crumbled tissue paper appearance, it is going to be very easy, straightforward. That is going to be Gaucher, right? And the moment we see crumbled tissue, and yes, it is anemia, hepatosplenomegaly in a child, it is Gaucher. Gaucher is due to deficiency of beta glucocerebrosidase, and the closest answer that is there is glucocerebrosidase. A 5-year-old child with hepatomegaly, fasting hypoglycemia, diagnosed with glycogen storage disease, liver biopsy reveals glycogen with abnormal structure of defective D-branching enzyme of glycogen. Actually, they have written the answer itself. There is defective D-branching of the glycogen. The glycogen is not able to be D-branched. Actually, this question has been repeated. If you see the first question that we have did, it was also very similar. I'm just opening the first question for you again. There is a short outer branch, right? There was again the D-branching enzyme problem was there. There was also hypoglycemia, and in fact, whenever we will see the glycogen storage disease and I will see there is hypoglycemia is there, I will always think of two disease, one GRK or maybe Cories. And because it's a 5-year-old child, fasting hypoglycemia, plus they have clear cut written D branching enzyme may problem hai. There's a problem in the D branching enzyme, so it is going to be the Cori disease. A neonate presents with the severe hypotonia, cardiomegaly. Muscle biopsy reveals glycogen accumulation in the lysosome. I think this test is made primarily on the glycogen. There are so many questions are coming from glycogen. This is the third question that has made that is coming from the glycogen. In the exam also, it may happen. It may happen that from one single topic there are 2-3 questions are coming. So, a neonate presents with severe hypotonia, cardiomegaly, muscle biopsy reveals glycogen inside the lysosome. The glycogen accumulating inside the lysosome, and the cardiac problem, the only glycogen storage disease where we have talked about the cardio problem, the ECG problem, that is the Pompe disease. And Pompe disease is due to deficiency of acid maltase. It's due to deficiency of acid maltase, right? The next is a patient with the history of chronic alcoholism presents with acute confusion, ataxia, ophthalmoplegia. The triad is due to deficiency of which coenzyme? Now, this triad, ophthalmoplegia, global confusion, ataxia, the mnemonic is GOA. It's Wernicke's encephalopathy, that is due to deficiency of vitamin B1. It's due to deficiency of vitamin B1. Right? Yes, very good. A 35-year-old male patient presents with the muscle cramp, myoglobin after intense exercise. Again, this is the fourth question from the glycogens coming, and after intense, and it is good for us if a single topic which we have read so nicely, and if the questions are coming from there. So intense exercise followed by muscle cramp followed by dark color urine. The blood lactate levels are not increasing. Yes, in the myocardial, the blood lactate that doesn't decrease because the glycogen is not getting broken down, so there is no anaerobic glycolysis. So I can say yes, it is the myocardial disease which is due to deficiency of muscle glycogen phosphorylase. Yes. A 7-month-old infant Patient presents with the jaundice, 7-month old. Jaundice, hepatomegaly, cataract, failure to thrive. The blood test shows elevated galactose. The child is having more galactose, cataract. More galactose, cataract. Yes, it is going towards galactosemia. But they're asking not the diagnosis, they're asking which enzyme deficiency. Galactosemia, the mnemonic we have discussed was FAB gut. Galactosemia, G for galactosemia, gut. Gut, GUT. Yes, galactosemia is uridyl transferase deficiency. So it is going to be galactose. And if you see, I would have easily eliminated the option A and D because they are related with fructose and galactokinase. And actually, B and C both leads to galactosemia, but the B is leading to classical one. And if nothing is specified, we'll go with the classical one. Yes, rightly said. Uh, Patient presented with the severe combined immunodeficiency, and which enzyme deficiency can cause the buildup of deoxyadenosine and lead to this condition. Maybe deoxyadenosine word is maybe a hint for us. And if you know directly, it is very easy. SCID, severe combined immunodeficiency, it is due to deficiency of adenosine deaminase. And one more hint, actually, they have given there is a buildup of deoxyadenosine, because if adenosine deaminase is not there, the deoxyadenosine is going to accumulate. Yes, it's going to be adenosine deaminase deficiency. Yes, it is easy question again. A neonate with intellectual disability, seizures, and a musty odor is diagnosed with phenylketonuria. Actually, when I came here, musty odor, already the diagnosis was coming in my mind, phenylketonuria, but they have already written phenylketonuria. Supplementation with which of the following is indicated for this patient? In phenylketonuria, which amino acid is to be supplemented? What is not to be given? Phenylalanine. Don't give phenylalanine. But what is to be given? Tyrosine, right? So now they're asking that key, uh, what is to be supplemented. I'm thinking that the tyrosine should be given, but when I look at the option, the tyrosine was not there in the choice. Now let's look at the option then. Tryptophan, phenylalanine, dihydrofolate. Definitely phenylalanine cannot be the answer, because we never give phenylalanine in phenylketonuria. Tryptophan, it is nothing to do with phenylalanine. It's actually tyrosine which is to do with. Now we are left with two choice, B and D, dihydrofolate and BH4. Yes, the answer will be BH4, because to convert the phenylalanine into tyrosine, we require BH4. And if we give BH4, actually the phenylalanine will start converting into tyrosine. So yes, the answer will be B. So there are two answers that can be there in this question. If the tyrosine would have given in the choice, we and this BH4 is not given in the choice, we would have gone to tyrosine. So among them, the tyrosine and BH4, because the BH4 is given, so we'll go with the BH4. The next is a patient is with poorly controlled diabetes develops cataract. Diabetes is developing cataract. Yes, diabetes cataract is common, and the accumulation of the sorbitol in the lens is okay. In diabetes, the sorbitol accumulation leads to the cataract. The accumulation of sorbitol in the lens is due to which of the following enzyme activity? Why the sorbitol is made? So the glucose converts into sorbitol. The name of the enzyme is, they basically asking the name of that enzyme which is making the sorbitol, and the name of that enzyme is aldose reductase. Aldose reductase, that is making the sorbitol. Yes, no, it is not the A. It is not A. It is going to be B. What they are asking is why the sorbitol is made. The glucose converts into sorbitol because of aldose reductase. Aldose reductase. A patient presented with progressive muscle weakness and atrophy. A biopsy reveals lipid accumulation within the skeletal muscle cells. A deficiency of which enzyme is there? I will try to read it again. A patient presented with progressive muscle weakness. The muscles are getting damaged. They are getting atrophied. The biopsy reveals lipid is getting accumulated in the muscle. Means the lipid metabolism is not happening in the muscle. The muscle is unable to cut the lipid. Which enzyme deficiency can be there? So I have to think that which enzymes are required for the burning of the fat. For the burning of fat, acyl CoA synthetase is required, cat is required, right? And actually there are two options are there with the cat: carnitine palmitoyl transferase 1 and carnitine palmitoyl transferase 2. See, the cat1 is there in the cytoplasm, that is taking the lipid from the cytoplasm to mitochondria. The cat2 is inside the mitochondria. So if the cat2 is not there, the mitochondria will get damaged. And if the cat1 is not there, the lipid will accumulate inside the cytoplasm of the muscle. Now, because they have not specifically mentioned that where is going to be the problem, so because the cat1 is more common problem that is there with the overall cat transporter, so I will go with the option B. I'm going with the option B because that is more common. See, in the beta oxidation, we require the cat1 and cat2 because both are there. Cat1 and cat2 both are in the choice, so I will go with the cat1. I will go with the cat1. The next is a patient presented with the episodic hemolysis, and after consuming fava beans. Hemolysis is happening after eating fava beans. Which of the following finding would be expected in this patient? See, fava beans generates a lot of free radicals, and this patient is unable to tolerate free radicals, and he's developing hemolysis. Means that he's not having the shield on the RBC. There is a shield on the RBC which protects the RBC from that. So this patient is not having the shield, and the shield is made up of NADPH. So which of the finding would be expected? There's decrease in the NADPH. This patient is having G6PD deficiency. Yes, rightly said. Very good. A patient presented with lactic acidosis, seizure, developmental delay. Laboratory investigation reveals there is elevated of alanine. The patient is having more lactic acid, more alanine. Which enzyme deficiency will be there? Now, if I just read the question till lactic acidosis, then in my mind the pyruvate dehydrogenase is coming. But if I read, if the pyruvate dehydrogenase deficiency is there, only the lactic acid should increase. The alanine should not increase. The alanine is also increased. Means this patient is having the problem with the gluconeogenesis, maybe because alanine converts into glucose, and to convert the alanine into glucose, uh, we require the pyruvate carboxylase. We require the pyruvate carboxylase. Maybe this patient is having the problem with the pyruvate carboxylase because see, this cannot be the answer. Pyruvate dehydrogenase cannot be the answer for sure because that is nothing to do with the alanine. Lactate dehydrogenase, again, this cannot be the answer because that is nothing to do with alanine again. Alanine aminotransferase, that is related to alanine, but it is not related with lactic acidosis. So there is one enzyme which is coming, which is common for the alanine as well as lactic acid pathway. So I am going with the pyruvate carboxylase. I am going with the pyruvate carboxylase because that is the only enzyme which is common in alanine as well as because alanine gluconeogenesis, pyruvate carboxylase, and that can also be there. Coming to the next one, a child with fair skin, blue eyes, developmental delay, eczema is diagnosed with phenylketonuria. What is the biochemical basis of this disorder? Why the phenylketonuria develops? Phenylketonuria, it is due to deficiency of phenylalanine? No. It is inability to convert phenylalanine into tyrosine? Yes, it is there. But still, let's read the other option. Excess tyrosine? No. In phenylalanine, there is less tyrosine. Defective phenylalanine transport in the cell, there is nothing to do with the transport. It is the inability to convert the phenylalanine into tyrosine. So yes, we were lucky actually. We have got relatively easy paper. And what you suggest, guys? What will be the score that we are going to get? If such paper will come, definitely you are going to score the maximum, right? So still we are having a time of 2 minutes 44 seconds, right? So should we submit or should we review the question? So Anuj is saying we are going to get 18 marks. I am little skeptical about one answer. Maybe while clicking the answer we may have mistake. We may have made a mistake while clicking the answer. Piyush is saying only 10 numbers. Yeah, इतना भी खराब नहीं है कि 10 नंबर आएंगे. Yes, we can recheck, right? Okay, let me recheck. Okay, pyruvate dehydrogenase. Mm-hmm. There is no problem with HGPRTs, alpha galactosidase, OTC. Okay, so it's going to be auto submitted, right? It is going to be auto submitted. Let's wait then. If it is getting auto submitted, then there's no problem. Meanwhile, where this we are having a time of 1 minute 30 seconds. Obviously in the exam I will not have the access to mobile where I can continuously checking on the YouTube, but so I can read your comments also. uh, I was about to write 100% but not. Only 10, Piyush? Uh, moments before the glory. So I hope glory comes to you, to everyone, right? You have worked so hard for last so many months. You are preparing tirelessly and sleepless nights that you are having, and definitely you are going to make it happen. You are going to make it happen, and just these few days you have to keep fighting again for next 20 days or so. uh, just flip the pages and the things will start falling into the place, because now is the time where we have started our final revision, right? uh, यस प्रवीण, मुझे भी ऐसा लग रहा है, प्रवीण को लग रहा है कि ऑलमोस्ट सही लग रहा है, मेरे को भी लग रहा है प्रवीण. Yes, Neha, it feels like this. We feel like this. So just continuously flip the pages. You continuously flip the pages, and the things. I know these. Sometimes you might feel that कि यार बस कल exam ले लो and just खत्म करो, right? It may be like this. So it may be there, but anyways, we'll see. I'm just waiting that maybe we may have did one or two silly mistakes. So we are waiting that let's get it auto submitted, and we'll see if we have done any silly mistake or not. So it's time's up. So where to see the answers? Okay, we have not done any silly mistakes. We have not done any silly mistake. No scope, sir. No, it's nothing like that. Let's quickly review actually. ये इस क्वेश्चन में there was, I was very much sure there is no problem. Shorter outer branch is there, and hypoglycemia. The moment I will see hypoglycemia, I will go for two answers. Either it's when von GRK or it is the Cori disease, and because they have written something about the branches, so I will go with the Cori. No problem. A patient presents with elevated lactate level and hypoglycemia. What is happening is basically in the elevated lactate level, the pyruvate is converting into the sorry, glucose is converting into pyruvate. There are two options: either it go towards the lactic acid, go towards the acetyl CoA, and because the it can't go towards the acetyl CoA, so everything is going towards the lactic acid, and that is why the lactic acid is more. That is pyruvate dehydrogenase deficiency is there. The next was it was very sure. I was very sure about that maple syrup, and I think that every one of you also should be sure, right? Maple syrup is branch chain, and branch chain is leucine, isoleucine, valine. There should not be any doubt in that, right? Now coming to the fourth one, a patient is diagnosed with Leishnian. Let's jump to the answer. HGPRTS, Leishnian HGPRTS. I was very sure because of this word actually, angiokeratoma. Because the moment I saw this word angiokeratoma, Fabry disease came in my mind, and that is due to deficiency of alpha galactoserboside. Then the next question, hyperammonia with orotic aciduria. Again, hyperammonia, we have discussed hyperammonia type 1, type 2. Type 2 mein, there is orotic aciduria is there. So the answer is going to be type 2, which is deficiency of OTC. Then statin, it was easy question. Statin was, what they're asking is mechanism of statin, HMG-CoA reductase, HMG-CoA reductase inhibitor. Here the hint was crumbled tissue paper appearance. The crumbled tissue paper appearance, it is because of Gaucher, and Gaucher is due to deficiency of beta glucocerebrosidase. Done. Then the D branching enzyme is not there. So we have the mnemonic A, B, C, D. D branching is due to Cori. Yes, so the answer is Cori. And one more hint was there, hypoglycemia. The next question was, a neonate presents with severe hypotonia cardiomegaly. There is only one glycogen storage disease actually, and I was lucky that there were so many questions were coming from glycogen storage disease. There were 4 questions that came out of 20. So cardiomegaly, it is the Pompe disease, acid maltase. A patient is presenting with the history of chronic alcohol of, this is the mnemonic GOA. Do you remember global confusion, ophthalmoplegia, ataxia? GOA, it is vitamin B1 deficiency. Then it was again easy. Muscle cramps, myoglobinuria. It is going to be McArdle's disease. Actually, there was one question where the things were little dicey. This was easy. Skid, it is adenosine deaminase. It was someone is asking that why not tryptophan. See, there is nothing to do with tryptophan. Tryptophan का क्या लेना देना? There is nothing to do with tryptophan, right? With phenylketonuria, it is related with phenylalanine and tyrosine. There's nothing to do with tryptophan. So the answer is going to be tetrahydrobiopterin. Yes, very good, very good. And a patient presents with a poorly controlled diabetes cataract, and the cataract develops because of sorbitol. They're asking that why the sorbitol is made because of this enzyme aldose reductase. Can anyone tell me that which drugs can inhibit aldose reductase enzyme? Aldose reductase inhibitor, what is the name of that drug? The name of the drug is, anyone can tell? Is that is epalristate. Aldose reductase inhibitor, epalristate. Okay. Then yes, this was a difficult question. Cat 1, Cat 2, because the cat 1 was more commonly deficit enzyme, so I have went with that. I have went with cat 1, not the cat 2, right? Carnitine palmitoyl. uh, the other name of palmitoyl, we can say carnityl acyl transferase, right? That is the same thing. Actually, to transmit the palmitic acid, we use the carnityl palmitoyl transferase. So that is basically the cat 1, cat 2. This was a tricky question. This was easy question. Fava bean leading to hemolysis. It is G6PD deficiency. The patient is not having NADPH. The 19th question, yes, it was again. See how I have figured out the answer, because they are asking lactic acid as well as alanine. So I was trying to find the common enzyme which is related with the lactic acid as well as alanine both, because the pyruvate dehydrogenase, it is related with lactic acidosis but not alanine. Lactate dehydrogenase related with lactic acid but not with the alanine. Alanine aminotransferase, it is related with alanine but not lactic acid. The pyruvate carboxylase, it is related with gluconeogenesis, and in gluconeogenesis, the lactic acid as well as alanine both comes. So I went with that answer. And this was easy, phenylketonuria, right? So this is how we should approach. And it was very nice to have this different kind of session. Soon we are going to have the discussion where I will be giving the explanation also at 9 p.m. On the, yes, here only on the YouTube we will have again one more session that is also going to be very short. I know that you have a very precious time right now going on. I will not take you much of time in that session also, but there we are going to discuss important MCQs, the 20 important MCQs for biochemistry, what, how we are going to figure out the things. There the MCQ may not be that easy. I was lucky that I have got the easy paper today. uh, Thanks to DocTutorial for that. And the we'll see in that session again. We'll see you, and we'll wait for your answers in the comment box, right? That see you then at 9 p.m. Thank you guys. Thank you.